A client is on furosemide therapy. Which among the following food items, if selected by the client, indicate his or her knowledge regarding the furosemide therapy? Banana and orange, egg and dairy products, C. Food items or cereals. And here the right answer is option A, banana and orange. Furosemide is a low-acting diuretic which eliminates the water and potassium via urine. By giving food items such as banana and orange, it helps to replenish the potassium storage in the body. Nurse is assisting a client for enema administration. Which among the following position is needed to give this client? Lithotomy, left lateral, semi-Fowler's or prone position. And here the right answer is option B, left lateral position. In left lateral position, enema solution flows down by gravity along with the natural curve of the sigmoid colon and rectum. The nurse in the scrubbing area should consider work skins from the edges of the sterile field as contaminated. 1 inch or 2.5 cm, 0.5 inch or 1 cm, 3 inch or 7 cm, or option D, 3.5 inch or 8.5 cm. And here the right answer is option A, 1 inch or 2.5 cm. The distance of 2.5 cm to 3 cm or 1 inch around the outer edges of the sterile field would be considered as contaminated, and sterile materials should not be placed in this area. Before the procedure, obtaining informed consent is the responsibility of physician, CNO, head nurse or nurse. Obtaining informed consent is the responsibility of physician. So option A is the right answer. Question number 5. Which of the following viral infection is transmitted by tick? Japanese encephalitis, dengue fever, Cayasnor forest disease or yellow fever? And here the right answer is option C, Cayasnor forest disease. Cayasnor forest disease is transmitted mainly from the hard ticks, particularly by H. spinifera or H. turcura. Keratomelasma is associated with diarrhea, measles, chickenpox, or option D, A and B. Here the right answer is option D, A and B, means diarrhea and measles. Keratomelasma is an eye disorder caused by vitamin A deficiency. Cornea gets cloudy and softens. Measles and diarrhea are associated with vitamin A deficiency that leads to keratomelasma. Diseases which are transmitted by water and food are called as vector-borne, airborne, fomite-borne or vehicle-borne. Here the right answer is option D, vehicle-borne. Disease transmitted via food and water is called as vehicle-borne. Diphtheria carrier is identified through throat swab culture, Gill-Nielsen scan, Gram scan or Albert scan. And here the right answer is option A, throat swab culture. Swab taken from nose and throat is subjected to culture and then identify the carrier in diphtheria. WHO declared global eradication of smallpox on 26th October 1977, 5th July 1975, 17th May 1975 or 8th May 1980. Here the right answer is option D, 8th May 1980. WHO declared global eradication of smallpox on 8th May 1980. Human milk is rich in all except fat, protein, iron or carbohydrate. And here the right answer is option C, iron. Milk is rich in all except iron. Mature human milk contains 3% to 5% fat, 0.8% to 0.9% protein, 6.9% to 7.2% carbohydrate, calculated as lactose, and 0.2% mineral constituents expressed as S. Its energy content is 60 to 75 kilocalorie per 100 ml. Protein content is markedly higher and carbohydrate content lower in colostrum than in mature milk. Iron is deficient in human milk. Apgar score helps to assess the depression of cardiopulmonary functions, psychomotor functions, integumentary functions or cardiopulmonary and neurologic function. Here the right answer is option D, cardiopulmonary and neurologic function. Apgar scoring system is used to assess the depression of cardiopulmonary and neurologic functions. It considers signs such as color, heart rate, respiration, muscle tone and reflexes. Although there is a risk of suicide in all patients with depression, the risk is higher in which of the following situation: recovery from depression at peak of depression, being married woman or female gender. Here the right answer is option A, recovery from depression. The risk of suicide is more after the recovery from depression because the characteristic psychomotor recognition has improved and the patient has more energy to carry out the suicidal plans. Symbol shown in photograph is related to which disorders? Alcoholism, depression, substance use disorders or autism. This symbol indicates autism disorder. Identify the child psychiatric disorder as shown in photograph: dyscalculia, dysphagia, dyspraxia or echolalia. And here the right answer is option A, dyscalculia. Dyscalculia is a learning disability that makes it difficult to understand, learn and use math. It's a specific learning disorder, meaning it only affects how someone learns math. Identify the equipment given in the picture: Hager's caliper, uterine sound, uterine curette or vaginal wall retractor. And here the right answer is option A, Hager's caliper. These calipers are used to tweak the vaginismus to increase the cervical dilatation, and these calipers are also used to increase the size of the stoma following colostomy. Black and debris discharge from the uterus after delivery is termed septic shock, leukia, pyuria or hematuria. And here the right answer is option B, leukia. Leukia is the vaginal discharge experienced after childbirth, consisting of blood, mucus and uterine tissue. It typically lasts for several weeks, gradually decreasing in flow and changing color as the uterus returns to its pre-pregnancy state. Drug used to improve the milk production is metoclopramide, sulpiride, dopamine or option D, all of this. And here the right answer is option D, all of this. Metoclopramide 10 mg kgs will improve the milk production by increasing the prolactin level. Sulpiride dopamine antagonist has also been found effective. Calcium requirement during pregnancy is 1.5 gram per day, 2.0 gram per day, 2.5 gram per day or option D, 3.0 gram per day. And here the right answer is option A, 1.5 gram per day. According to WHO, 1.5 to 2.0 gram oral elemental calcium. 1-year-old child comes to well baby clinic and nurse noticed the child's anterior fontanelle is still open. What is the appropriate nursing interventions? Report to doctor, normal findings, measure the head circumference, look for signs and symptoms of infection. And here the right answer is option B. The anterior fontanelle closes by 18 months of age. So in a 1-year child, this is a normal findings. The major cause for childhood illness is malnutrition, accidents, infestation or option D, infection. And here the right answer is option A, malnutrition. According to World Health Organization, malnutrition is the gravest single threat to global public health. Globally, it contributes to 45% of deaths of children aged under 5 years. তো বন্ধুরা, এই ছিল আমাদের আজকের ভিডিও ভালো লাগলে অবশ্যই লাইক, কমেন্ট, শেয়ার করো এবং চ্যানেলটি সাবস্ক্রাইব করে পরবর্তী ভিডিওগুলি পরস্পর দেখতে থাকো। অ্যান্ড থ্যাংক ইউ ফর ওয়াচিং দিস ভিডিও।